Hello everyone, this is Dr. Anam Zahir signing in on episode 40 Instagram Live Guest Talk with Homeopathy Heals. I hope you all are doing well, nice, happy, peaceful. So yesterday only we had 2 days back we had a World Cancer Day. So for a cause today we'll be talking about healing cancers with homeopathy. Not just the scope, we'll be talking about the limitations as well. And today we have a very special guest with us. She is whole and soul into treating cancers only. And let's, without wasting any minute, ma'am will be here any minute. Okay, great. Very good morning, ma'am.
Very good morning.
Okay, so before we'll start, I would like to introduce you as I have asked a lot of questions about ma'am, and many of you were right because ma'am is mentoring so many students all across the West Bengal, all across the Gujarat. She is none other than Dr. Shruti Shah. She is MD in homeopathy and PhD in homeopathic physician, and she is practicing since 20 years in Gujarat, and her specialization is the treatment of cancer in homeopathy. She has published many research articles in very prestigious journals and international conferences. She is recently has authored a book that is Treatment of Breast Cancer with Homeopathy, and she is also one of the founder member of Cancer Foundation named as Prayas and has got widely clinical experience. She is also an associate professor of Materia Medica at university and teaching subject since 15 years. So those who want to, after the session, those who want to get the medicine, I'll be reviewing this book and posting video on YouTube channel and Facebook as well. But those who want to know about the book, I can tell you after the session. So without wasting a minute, ma'am, again a very warm welcome to you.
Thank you, Dr. Anam. It's indeed a pleasure.
Okay. And I'm so glad that ma'am on such a short notice and you accepted the invitation and we are here and we are celebrating for a cause, the World Cancer Day. Am I audible, ma'am?
Yeah, you're audible. Is my video audio clear to you? Because
Yes.
as I said,
Yes.
I'm at, see, I'm talking from River Ganga. I'm on my tour and it's a beautiful place.
Ma'am, we might have rescheduled it. Yeah, indeed, I'm jealous. I'm jealous. Why mountains are not calling me?
So you are here virtually in this rainforest.
Virtually. Yes. That's beautiful. And actually, I am a populous indicus kind of person. I have a lot of motion sickness. I cannot travel. So beaches calls me, wherever I can fly, I can go. No cars, no bus.
Okay, I know.
Okay, let's start. So, ma'am, my very first question is, what made you turn the application of homeopathy for cancer treatment?
Yeah, Dr. Anum, there is a sad incident behind this. I have one of very close relatives of mine who came to me. She was unmarried and was like mother to me, and she had difficulty in deglutition. So I bought her to my house. It was I think 10 years back, and I consulted her to one of the physician in my building, and she said, "Okay, there is a suspicious." Am I really clearly audible, Anu? Yeah. Okay. So she said there is a possibility of esophageal malignancy, and she was not able to eat, she was not able to drink. And before her, I have never treated any cancer patient with homeopathy. So I turned the pages of Repertory and Materia Medica and found the medicine Conayam for her. Before her investigation, she was sent for endoscopy and biopsy and all. So uh, everything took 10, 15 days, and by meantime I started her treatment with Conime. She was my first cancer case. And within 15 days, her deglutition improved a lot. She gained the lost weight and she started doing much better with Conime. So I was happy. Yes, and after 15 days, her diagnosis was confirmed that she has got esophageal cancer. Her brother was a pediatrician, and as soon as he came to know that she is having malignancy, he called her immediately to start the treatment, conventional treatment, radiotherapy, chemotherapy, and all. But by 15 days, she was, I could say symptomatically, she was 80% better because her food intake and water intake and general stamina, that all improved a lot with Conayam. But then she went for the conventional treatment, and by 15 days, I could never talk to her because she lost her voice in the first week of her radiation, and after chemotherapy, after 1 month, she got uh, pneumonia, which was a secondary infection, a complications of immunosuppressive drugs, and she passed away in 1.5 months. This made me very sorry that I knew as a physician she died not due to cancer but due to side effects of conventional therapy. And while I was searching for her case, I found that yes, there are so many medicines listed in our Materia Medica, our therapeutic book for cancer. So if they are listed means they are really capable to cure, but we have no surety that how they would help us. So after losing her, I realized that there is a tremendous scope that we can offer with homeopathy. If she would have continued with only Conayam, I think she would have lived uh, more with much less suffering. So this really seed my eyes. And after that, one lady came to me. She was a regular patient of mine, and she was diagnosed with breast cancer. And they were from very middle class family, so they sold off their home, or her jewelries were sold off, and they were taking the surgery, chemotherapy, radiation. But within 6 months, her cancer spread so much, then she was diagnosed uncurable, and she came to me. Can you do anything with homeopathy for me? My son has got his final exams in the March, and this is December. Doctors have said that I don't have more than 15 days. So can you do anything with homeopathy? I tried and I found that there are remedies, but my skill, my expertise was very limited. So I couldn't help her much. And she passed again in 15 days. So this two incident happened very in close intervals. So this really stirred my mind that yeah, there is a scope, but I have lack of expertise. There is no awareness, and I have felt always very bad for pediatric cancer patients. So one fine day, and I was wondering how could I help. But one fine day, I thought because these two incidents kept on hunting my mind. So I decided, no, I want to do something for homeopathy with cancer. I want to do something for cancer patients. And one fine day, with a strong conviction in my inner mind, I then read our Materia Medica and repeatedly for many days that what are the possibilities to treat cancer with homeopathy. And I was thoroughly convinced because I have found many cured cases. I read from Grimmer, I read Dr. William Cooper's work, I read Dr. Burnett, and so many cancer medicines are listed in our Materia Medica. So one fine day, I decided that we are going to have a cancer special OPD, and I started a foundation, and we started with I allotted 2 hours of my clinical practice for cancer patients. We kept a wooden box in our clinic that whosoever cancer patients comes, they can free to pay whatever they want to pay, but we are offering our homeopathic remedies to cancer patients, and this way the foundation and clinic started. So this how I got turned towards homeopathy and cancer.
Okay, that's so good to know that people like you across the globe just doing such a noble job. Even I was not aware of this foundation and the kind of work you all are doing, and I'm really inspired. Then looking forward. in future will be treating the cancer patients the same way. They can drop whatever they want. I mean, my huge and massive respect to you, ma'am.
Thank
Let's
you.
move
Thank you.
forward. I just want to know what is the scope of homeopathy in cancer management? What you found in your 20 years of experience?
Actually, my 20 years of experience is with homeopathy. In cancer therapy, I'm since last 5 years. After I started the foundation, और फिर it is said ना कि लोग मिलते गए कारवा बढ़ता रहा. Like people joined me, like-minded people joined me, and now it is something which started with a wooden box. uh, kind of setup. Now we are having a registered trust, and I have treated so far more than 1,500 cancer patients with homeopathy. So, as far as scope is concerned, for initial 2 years, we got patients who were terminally ill. They were declared incurable by modern medicine, and then they come to me to seek help. If they are termed incurable, they are about to die, but if you can alleviate the suffering, if you can palliate. So initially my patients consist of such terminally ill patients, but after I started giving them treatment, I found yes, we can really help them with pain, with mental state, with vitality, and many of them died, died laughing, smiling, and peacefully. They were eating, their pain was quite less. So yes, my first 2 years were just, yeah, I was a doctor who was helping patient die peacefully. But later on, the word spread through mouth, and then patients started coming of all stage. Like we had got virgin cancer patients, we patients who were coming for who were in remission state, and they wanted के अभी remission relapse नहीं हो. Patients who came for to treat side effects of chemotherapy and radiation, and I can say we are very successful with homeopathy as far as side effects of chemotherapy and radiation is concerned. We can really help such patients. I would say the greatest achievement homeopathy can do is to prevent the relapse. Like patient has, there are 60 to 80% cancer patients will relapse even though they have gone for surgery, chemotherapy, and radiation within 5 years. 60 to 80%. But as we have completed 5 years, and if I do the statistical analysis, I can say 90% of patients 95% of patients have not developed cancer after they have started taking homeopathic therapy after once they were diagnosed of cancer. So this is something, a huge achievement we can have through homeopathy, because when generally 80% cancer patients relapse, with homeopathy I would say rarely 5% relapse within 5 years have relapsed. So this is a greatest scope, and I'm looking forward to collect the data of many more patients and then present to the scientific fraternity. Yes, that this is possible with homeopathy. And now we have started getting virgin cancer patients that they don't want to go for conventional treatment and they want to take homeopathy as a sole therapy. So in here, this area, my skill is still uh, developing. So I can say 30 to 40 cancer patients I am able to cure with homeopathy. For 60%, I try for 2 months and then I have to send them for surgery, or they are not. But yeah, the progress of cancer is halted. It does not develop further, but sometimes reversal is not possible. But yes, 30 to 40% patients, because of my limited ability, 60% are still not fully cured, but 40% cancer patients, they get cured with homeopathy. So this is the
That's
scope.
so good to know.
Yeah.
And ma'am, what is really good? You being so honest. We see on social media people publishing cases of definitely if they have treated or if they have cured cancer and it never relapsed. But what I like most about you is you being so honest. You know, the accepting what is the truth, what is the fact. This is very big thing, talking on social media. I'm really there's so much impressed, the words, the kind of words you have chosen for the session. But ma'am, where there's
Uh,
a scope, there is a limitation as well. And like other science, homeopathy might be having limitations as well. So what is your quote on this? Do you think homeopathy has any limitation as a science?
Of course, it has, right? Since we enter into the homeopathy college, we have always listened about the glory of homeopathic science. And yes, I am a big fan and lover of homeopathic science. It's my passion and mission for life, certainly. But Dr. Hahnemann has improved 6 times. But still, in spite of such a beautiful, wonderful, miraculous results, we are a second choice. We are not the first choice for,
Alternative.
yeah, we are alternative. Though we have all the capability to become a first line of treatment, because see, homeopathy is such a difficult science that after 20 years of practice, I think now I have started actually learning it. So it is very difficult, and we do not have that association, that integration that we can uh, put our results together in the modern and scientific community, right? Uh, Doctors, institutes, they are working together, but yet we have not proved it scientifically. The efforts are really very major. It's not a huge or good contribution, significant contribution. I am saying that I am curing 30 to 40% cancer patients with homeopathy. But this saying of myself, this self-claiming has no meaning unless and
Hmm.
until I prove it to the world that it is curing. Right? So, yes, this is a limitation. And the limitation I have really faced as a clinician is lack of protocol. Right? Because if you give one case to two different homeopaths to uh, treat, I think they will
Different.
not have a single common prescription.
Hmm.
So, this obscurity is not good for any scientific uh, medicine, right? We need to be more clear that what we need to prescribe, how we need to prescribe, and there should be a single conviction, convincing way to prescribe. So this is, yes, a limitation of homeopathy. It has its own strength, but there are a learning is never. There is no end to a learning. We need to improve a lot as a scientific community.
Ma'am, my next question is, since you've been working with cancer and cancer patients, what are the challenges you are facing as a researcher and as a cancer physician?
Every day rises with a new challenge. So the challenge is endless. But the biggest challenge I face is a lack of institutional support. Right? There are ways, there are institutes which support, but you have to uh, manage the pharmacy, you have to speak for your work, you have to do research, you have to find remedies, you have to convince the cancer patients, you have to run your home, and these are limitless challenges I face as a cancer and modern medicine allopathic doctors, which are the front runners of medical community. We have very limited support and belief rather from them. So these are the things, and we are responsible for the challenges we are facing. But yeah, every day rises with a challenge, and as I said, my own limitation, because homeopathy is really very difficult science to practice, to understand, to learn.
Very true. Very true. So, ma'am, you're doing this wonderful job. You have even a charitable foundation also for this. So, ma'am, what is the response of modern medicine doctors towards your work? Can you throw some
Uh,
light on this?
Yeah. So I say there are 20% doctors who respect our work. 20% could be my misjudgment also, who come forward to support us. Uh, they encourage, but mainly because I have good personal relationship with them. But majority of doctors, they think homeopathy is just pseudoscience, it's a placebo. When my patients go and tell them that we are taking homeopathic medicines, they say that we don't know the side effects, don't take homeopathy. Along with, though they have no knowledge, they discourage the patients and sometimes stop them having the wonderful benefits homeopathy is able to provide. Even if I tell you, I had a patient of Wilms tumor, a kidney cancer. It was she was a 2-year-old girl, and she was diagnosed to have a kidney cancer. So she was advised that she has to remove her kidney and adrenal both, and then take cycle of chemotherapy, radiation. I saved one patient before her of the same pathology of same age, losing life even after the therapy. So I was very much alarmed. But the patient's relatives were very confirmed that she is just 2 years old and she had so much pain that she was not able to stand. It was very difficult to examine her. She was weeping, weeping, and weeping. That we don't want to send her to any medicine. If she lives, God's grace. If she cannot make, God's grace. But we don't want to remove her kidney and put her to this harsh treatment. So took the challenge. I grasped the opportunity. She was my first pediatric patient, virgin case, where only homeopathy was given to her. And due to homeopathy, wonderful homeopathic science and God's grace, now she is free of cancer. She is absolutely cured with homeopathy. Right, so this
That's
is
so
an
good to know.
achievement. Yeah, but the pediatrician who was treating her, he was knowing that she was taking homeopathy. He was forcing them to assess her. And one fine day he realized that she is totally free of cancer. Her cancer is cured. He said that no, maybe it was not cancer. Right? The reports were wrong.
Just
I mean,
because cured and treated by a homeopath. Just
yeah,
because.
and this is the everyday story.
Yeah, I can
Uh,
understand. I can understand.
yeah, this
Yeah,
happens.
but as Lord Krishna has said, we are, responsible for our work, not for the result. He has said this in Mahabharata.
कर्मण्येवाधिकारस्ते मा फलेषु
Raste,
कदाचन. Yes, Dr. Anu
Mahasukara.
Raste.
Okay. So, ma'am, my next question is, what is the homeopathic perspective of looking at a cancer case? Is it different from other diseases, or how you approach a case of a cancer?
Because cancer is a very complex pathology. So, though we have to look at it like other diseases, but we have to be very clear that we have to go layer by layer, step by step. So, when a cancer patients come, there could be mental symptoms, there could be miasmatic symptoms, there could be symptoms due to disease toxicity, there could be symptoms due to side effects. So you have to learn to separate the symptom complex in front of you and then go layer by layer. You have to understand what is uh, the uppermost layer, what symptom complex requires immediate attention that you have to deal with, and then you have to go layer by layer. And it is very complex, so it is bit different than how we treat other homeopathic patients.
Okay. So, ma'am, what you will, suggest, whether you give the similimum, the deeper remedy, constitutional approach, or organopathic approach?
I think I give all.
Yes. Because eventually there is only aphorism number one which comes first. I can
Yes.
definitely
See, Dr.
understand that. Yeah.
Greemer, yes, Dr. Anum, if you know Dr. Greemer, he was direct disciple of Dr. Kent, And I have learned this from my mentor, Dr. Sunirmal Sarkar, that in the chapter Naja, he has treated he has treated thousands of cancer patients successfully with homeopathy, and he has written that a cancer patient will rarely yield to a single remedy. You need to give uh, many homeopathic remedies one by one. So you need to give one constitutional remedy, but one remedy will never cure cancer. You need to give organopathic, nosodes are must, pain management, acute crisis, and then similimum. So there will always be a series of remedies which will be required to uh, treat cancer patients with homeopathy. A judicious use of
Okay.
all the weapons available to us.
So, ma'am, these were a very different question we have. Uh, that is there any medical legal issue to be considered while dealing with a cancer patient? Do you take care of something, some to avoid any medical legal aspect when it comes to
Yes,
this?
unfortunately, I have not faced anything, but yes, we don't say patients that we will cure it, right? We
Yeah.
never assure, we never guarantee anything, and luckily, India is one of the paradise for homeopathic practitioners that law and government protects us. So there is no issue, but don't false claim, don't advertise, don't assure, and don't say them don't take allopathic medicines. Right? I choose it upon them. I tell them to use Google, use your own discriminative power, and then decide for yourself. So I don't stop them for taking surgery. If they insist, I share my opinion, but I say that this could be my opinion, and we never make any claim that we will cure it. We always tell them that there is a possibility, and what I can do that I can try my best. But this is a challenging pathology, and we are never sure of outcome.
Okay. So, ma'am, for an example, if a patient is coming to you after so many chemotherapy sessions, and the effect of chemotherapy at times, or most of the time, it distorts the complete image of the patient and as well as the disease picture. What is your approach in such cases when you have a distorted image of a disease as well as a patient?
This is a very common scenario, right? So generally, what we do, so many times we use the potentized chemotherapeutic agent. If there are evident side effects of the drug has not, this is not routine. But if we see that these symptoms are calling for the side effects of the drug, we use the same drug in potency. This is one of the approach. Then we have medicines like very small medicines like China, Ipecac, Nux vomica, Sepia, Alosocotrina, Teucrum marum verum, which nullifies the side effect of excessive drugging. We advise them for yoga, meditation. We use mother tincture to detoxify. We give a good counseling and lifestyle. And when the patient starts showing the natural disease picture, then only we go to similimum or constitutional. But it's a huge challenge. As I said, so many times patients die due to uh, side effects than the disease itself.
Oh,
So yeah, it's a challenge. And
yeah.
one
My next,
unfortunate
yeah,
thing, yeah, yeah, my answer,
yeah, yeah.
the patients
Uh-huh.
who have been drugged with so many medicines and patients who have relatively taken less medication, the prognosis is always better with the patients with less medication. The patients we have come who have come with excessive drugging, whose system is poisoned with lots of chemotherapy and radiation, generally we have very poor prognosis. One fine day, in spite of no symptom or in spite of our medicines are doing and seemingly looking to help them, but patients collapse, they succumb. So yeah, they are challenging one.
So, ma'am, my next question is a bit personal. If you want to bypass it, you can bypass it. I want to know, your experience of writing a book. I think it takes a couple of months or years to type and edit and get published. But I think for the content, it will take half of a life of an author. This is my belief because every time I try to write any a book and the idea got dropped off, even in my mind. So, ma'am, you have, beautifully masterpiece this, published this, and we have name of legendary Dr. Sarkar sir also here. So he's also an co-author with you. So, ma'am, can you share some of the experiences while writing this book
Certainly,
or
I
the
would love.
responses?
I have nothing much to say about the response because, uh, yeah, people have admired, but I think as far as writing is concerned, it was not less than a tapasya, right? Typing, editing was a different thing. But I have worked upon more than 80 breast cancer remedies, and it was like I will start with one remedy. For example, first Enantharum muriaticum, and one medicine is Aristolochia clematitis. So for that, apart from homeopathy, if you know, see that I have worked a lot in phytochemistry, and I have gone through the modern medicine research to find that what has been done for our cancer remedies. So it will take me reading more than 1000 or sometimes 5000 research papers, and I will read, and then contemplate about it, and one fine day I would understand. Like for Aristolochia sarsaparilla, you cannot imagine that how many cancer research papers I have gone through to understand how to correlate, how to integrate our homeopathy works with the modern medicine. So it was 3 years project, and I used to go into woods. I used to go into villages. I have two young children to look to take care of, but my family is supportive. My children are very supportive, and day and night I used to read. I used to meditate, and then one drug used to get sold. Then yeah, Eureka, I used to share with my team. Yes, I cracked the code of this drug too this time. So it's a long journey, and uh, it's like churning of all my neurons. I have not worked more than for anything what I work for my book. But
Yeah,
yeah,
that's
it is
so
very
true.
difficult to explain to the students, doctors, that what I want to convey, because it is something somebody has read and told me that world is not yet ready to understand what you have done. See, it is little looks like little self-boasting, but yes, it has been a tremendous journey. And for 80 drugs, I think I have gone through more than uh, 15,000 research papers.
It's a huge, huge number. Ma'am, definitely audience is dropping question like this. If we want to get this book, so how to whom we can mail or where we can get this?
You
Or is it
can
available
mail.
with the Bejan publisher?
Yeah, it is published
Or
by
is it
BJ.
available with you?
It is
Yeah,
available with me, and it is available with BJ Publications. So you can choose either.
no problem, no problem. Ma'am, I'll share your email address at the story. So those who want to buy this, purchase this, they can directly mail you. Is that okay?
It's perfectly okay.
Okay. So, ma'am, before ending, there's my one last question. What advice you want to give to younger homeopaths?
Uh, yes, Dr. Anum. After 20 years of practice, it is a time duration where I have learned something, especially from my mistakes. And my mistake that I thought I could treat any kind of pathology with homeopathy, but as I said, it is a super science. So if you want world to get convinced that what you are capable to do, and if you want to save your resources, if you want to utilize the best part of your energy, choose one subject, one pathology, and start working from beginning on that. You can be self-acclaimed psoriasis specialist, kidney stone specialist, cancer specialist, gynecologist, but practice in one area that will help you to master that subject as well. Your work will get recognition easily, and you can, like, now if someone has to treat the cancer patients with homeopathy, they come to me. They know, okay, this doctor is doing this work. So if someone is working in a thyroid, someone is working in diabetes, so this will make the task much easier for everyone. So this is my advice to students, that choose one system, one pathology, and work on that only. If you want to do a specialized practice, GP is very
That
difficult.
that's so true. That's so true. Um, okay. Even I remember I had a when I just started my practice, barely I was in MD 1 year, first year or second year. I got a patient of gallbladder carcinoma, and he was responding pretty well with the homeopathic medicines, and he lived for 3 years even after metastasis, and he was able to eat, he was able to sleep. So one fine day he was doing well, and I was out of town, and his nephew came, and he told that he's taking homeopathic medicine from me, and shown my picture. Then he literally, said like this: "You are taking medicine from this kid. You come to me. I'll take you to one good multi-specialist hospital. You don't worry about the money." You won't believe I cried listening to when her daughter told me his daughter told me that he went to the hospital on his legs, and after 8 days we bought his body from the hospital, and I was out of town for those 8 days, and I was not informed. If I was informed that they are doing this, I would have stopped them. I would have even begged, don't do this. Metastasis has started. They will do just the trial and the research, the blood test, and all they could. And it is already evident here. There's nothing much, nothing more can be done here. And they were repenting, the family repenting in front of me, that if he would have continued with the homeopathic treatment, he might have lived for more 3 years or 5 years.
With ease.
Yeah, yeah. So that was, and I was very young. I was, I think, barely 25, 26, 27-year old. Yeah, 25, 26 years old. So it was very harsh for me to accept it. That
I
I felt
understand.
so helpless because I was not informed. I would have begged, really, I would have begged, don't do this, don't do this. And just
I can
because he said
relate to this.
you're taking treatment, yeah, you are taking treatment from a kid. He said like this, कि बच्चे से दवाई ले रहे हो. I mean, so I miss him at times. I keep him in my prayers. And with the 3 years, I have seen him eating properly, sleeping properly, giving medicine for pain different. If I say I was treating him with this one single medicine, I am lying. I used mother tincture, I used hydratis at time, I used chelidonium at time when he was not able to eat, and he was responding well. I cannot claim the cure, but I was able to make his life a little bit better and
So
less of
that is,
suffering.
yes, yes, yes. So that is amazing. And yeah, if you
Yeah.
have uh, 10,000 patients treated with the same pathology, no one will say that you are taking the treatment from a kid, right?
Hmm.
So this is our everyday story.
Yeah.
We go through the
Yeah,
same
yeah, that's
pain
so
and
much.
misery. Yeah,
Yeah,
I can relate.
that's so
So
true.
that is very
Thank,
well
yeah,
done,
thank,
Dr. Anum.
thank you. So, ma'am, thank you so much for sparing, a huge amount of your time. I'll definitely share the book review. I'll read the book. I was caught up in my own miseries. I'll need just 2 days and I complete this book and post a video review and article. I just want to take your consent. Can I send a written article review to BGen Publishers? They publish my book review articles in their journals. So I want
Yes,
your
that would be.
consent. Can I send it?
Yes,
A written
yes,
article
yes.
in the BGen?
Yeah, it's a pleasure,
Yeah.
Doctor Anum. You can certainly do that.
Thank you. I review new books also, and I review the old stalwart books from my perception. As a student, as a learner, that if I am going to buy some book, why should I buy that book? and what will I need to I'll learn from this. So I just share about the book review, the content, and how much you have worked for that. So I'll post a video review as well and send the article to the Vision publishers. So thank you so much, ma'am, for being here. And it was so good talking to you. And everything seems very glittering, twinkling, but nobody knows the struggle behind it. Now I can understand, staying in the woods with the two kids and family and responsibility and writing a piece of book. I know it takes me 4 months at times to write an article of 4 pages. 4 pages article. At times it takes 4 months for me. And for a book, I mean, hats off, It you inspired so many homeopaths like me, coming homeopaths, that we can do even better. We need to hit hard, little hard.
So, just have a look of the property. Apart from homeopathy and cancer, where I'm staying, it's a beautiful place. Everyone can have a look. It's a forest, and Gangaji is
Please, please.
flowing. And then we shall
That,
end.
yeah, that's so beautiful.
Yes.
Take
There
me
is
there.
a stream nearby. Are
Yeah.
you able to see well, or
Yes,
is it?
yes, ma'am, yes, ma'am. Even we can listen,
Yes, it's a. There is a
the water
stream.
flowing.
Yeah, it's a beautiful place, and
Yeah.
I would
Ma'am,
like
can
the
you send me the
audience to.
address? Ma'am, can you send me the address? I can fly next
I
month.
see,
That's beautiful.
and yeah.
Oh,
So with a positive note,
yeah. Thank you so much
okay,
for being here, ma'am. And we look forward to have more episodes with you. Thank you so much.
sure,
Even I
sure.
was not aware of, yeah, ma'am. Some student texted me that please call Shruti, ma'am. Please call Shruti, ma'am. And I even don't have, she even don't have your email ID. Pata hai? And she sent me the number. And I was like, I cannot text someone on the number कि please episode पे आ जाओ. Fraud हो सकता है, मैम को लगेगा fake है, ऐसे कैसे आ जाओ? And then she was keep on. I sorry I missed the name. If you can drop which girl was that? Then I sent डर डर के मैम को मैसेज इनविटेशन का and ma'am you accepted it so sportively. I'm so obliged to have a word and to have you on Homeopathy Heals platform, ma'am.
It's pleasure, Dr. Anum, right? और होम्योपैथी
Thank you
में कोई
so much,
फ्रॉड नहीं होता.
ma'am. No, ma'am, even we were not knowing each other, है ना? And you even don't know what kind of talk we have, and still you agree to this. I mean, I'm so obliged, and I want to be like you only, like this, so sportive. Let's see what will happen. Even if you don't know who is going to interview me.
Okay. Thanks for your kind words,
Okay,
Dr.
thank you
Anum.
so much, ma'am.
Yeah.
Okay, okay.
Okay.
Thank you so much,
Chalo.
ma'am.
Bye
Thank you so
bye.
much.
Bye
Bye, ma'am.
everyone present here. Bye bye.
Bye, ma'am. Okay, so everyone, I would like to tell you, I hope you have learned a lot from the session. Please drop in the feedback and learning section what you have learned. And please stay tuned and await it for the review of this book very soon. And the next week, next Sunday, will be coming up as I'm not gonna keep a surprise. I will be coming with Dr. Bindras, and Dr. Bindra will be talking about cardiovascular disorder. And the title is itself is very exciting: Love and Depth in Homeopathy. And he's very straightforward, and he's a practitioner of organopathic and rare remedies, and he's very blunt, he's very bossy, and we'll be learning from him about the cardiovascular disorders as well. So I'm sure you all get your all cases you want to ask from Dr. Bindra. You get along with all your books, what to read, what not to read, and how to approach the cases, because so many cases we come with the lack of ejection fraction, at times pericarditis or cardiac failure. So we'll have a very healthy discussion on cardiovascular disorders as well. Thank you so much, Dr. Vansh, for your kind words and for being always with Homeopathy Heals. Your support is, very commendable. And I thank that girl. I'm so sorry I missed your name. Please drop me. I'll post thanks to you who told me about Dr. Shruti ma'am. So everyone, stay happy and have a nice week ahead. काम करते रहिए, पानी पीते रहिए, एक्सरसाइज करते रहिए, खुश रहिए, खुश रखिए. टिल देन विल मीट. स्टे फिट, स्टे हेल्दी. होम्योपैथी